That's frustrating.
Oh, that's weird.
Am I on now?
No. Once you deleted it, it saved as a YouTube video, and now I can see you like 3 minutes ago trying to figure it out.
Oh no, are you serious?
Yeah. Can you wait? Adrian?
Yep.
Can you wait for me, please? Okay, it works. Yeah. It's got a delay, but it works.
Okay, good. Is that you on right now?
Well, there's 4 people.
What? Oh, nice, awesome. Hey everyone.
Sorry?
Hey everyone, sorry about that. This is my first time going live on YouTube, so I'm actually pretty excited about this. So sorry about that. Just trying to figure it out here. Can you guys all hear me? Okay. Well, I have my moderator, Justin, and he's a pre-med student with me, and so he's going to help me out. So he'll be moderating the chat for us today, which is awesome. Justin, are you all good to go?
Yep, I'm good to go.
Perfect. That's amazing. Well, thanks everyone. So welcome, after all that, welcome to the inaugural series, the inaugural episode of Scrubbed Out Grand Rounds. So I really appreciate you guys spending some time with me, and I know you have a lot of people, a lot of content out there, a lot of people you can learn from, so I really appreciate you guys coming and spending some time with me today. So my name is Dr. Adrian Huang. I'm an orthopedic surgeon. I'm here as an orthopedic surgeon and coach, and my goal is to help you achieve a balanced, successful, and fulfilling career. And this is all part of that. I'm an orthopedic surgeon, but I have a passion for medical education, and I do that through an academic center. I'm here at the University of British Columbia in Vancouver, and I'm on the residency program committee. I teach residents and medical students and fellows on a daily basis. And I'm now actually the director of continuing medical education, which kind of fits the profile perfectly. And now I want to share all that with you. So I'm really excited to start streaming these grand rounds every Monday at 5 p.m. So thanks again for joining me. I think it's a really great opportunity for us to build the foundations of achieving that balanced and successful and fulfilling career. So I really want to make this a community. My teaching style is very open. So definitely ask questions as we go along. I'll be monitoring the chat as well. And definitely try to interact with this amazing community. So my first question to you guys is, where is everybody from? So if you can just quickly type that into the chat, that would be awesome. And as you guys are doing that, hey, Toronto, nice, awesome. Welcome from Toronto, amazing, thanks. And so if you guys feel that this isn't quite enough, I have just started a subscription service on my Instagram where I will be offering a weekly group coaching session, and we can answer any questions that you guys may have during that hour. And that's going to go for $24.99 a month, but the first 5 people to sign up for that get a big discount. So make sure you check out my Instagram, which is just Scrubbed Out, if that's something you feel like you want. And if not, these will always continually be free, and you saw the schedule. And it's gonna be every Monday. So anyways, enough of that, let's get going. Mastering the art of suturing, that's what everyone's here for. So today, we're gonna talk about hand tying and instrument tying. We're also gonna talk about a lot of the basics about suture safety and instrument handling. So let's get going on that one. So I will start, and I will begin with suture tying, instrument tying. And so I'm gonna flip the camera here. And so you can see I have all my instruments here. And does everybody have a suturing pad? I hope you do. And so the first thing I always say is try to practice with gloves on. That definitely helps mimic that live environment so much better. So if you have that opportunity, that is the best way to do it. Today, I have one white glove and one blue glove because for the tying part of it, that's going to be a lot easier for you guys to see live in person. So as we get going, so number one is let's talk about some of the instruments that we have. So here's our suture pad, obviously, and we have our suture. And so the things you are going to need are these things. So this, as you can see, is this one here is a needle driver. So you can see it's stub nose and it's straight. And as opposed to this is called a snap or a Kelly or a hemostat, depending where you go. The biggest difference is that this one left here in my left hand is curved, so you don't want that one, you want the straight one. And in addition to that, you want a pair of toothed forceps. So you can see that one right there. Let me try to zoom in on that one. You can see that's toothed on this side compared to this one is not toothed. So you want the toothed ones. And the reason you want the toothed ones is because that actually does a better, protects the skin a little bit better. So when you're grabbing skin, the toothed ones will pierce, and that's actually better than the non-toothed ones, which actually crush the skin. So that's why you want toothed forceps. When you're starting to, when you're starting out, the real important thing is always practice never touching the suture with your hand, because that is how you get needle stick injuries. It takes a lot longer. It takes, a lot of practice, but for sure, if you want to have a long and safe career, definitely do that. The times you're going to stick yourself is just, it's going to be 3 o'clock in the morning, you're doing something on call and you're not paying attention, and all of a sudden, you stick yourself, and next thing you're on, antiretrovirals, which is not ideal. Today I am using this quite thick suture. You can see it's called Ep1. So normally this is not what you would normally suture with. But that's what I'm going to use because it's hopefully easier for you guys to see. You can see I'm handling everything with my sutures and my needle driver and my forceps. And so the first thing is so great question, 13. So I'm actually perfect timing on that one. So the question is it feasible to palm things? So if you're a beginner, what I always say, the proper way to hold a needle driver is with your thumb in one of the rings and your ring finger in the other ring, like so. And your middle finger or long finger is here for a little bit of support, but most importantly, your index finger should go right at the neck there, right? So right where it opens. And the reason you need to do that is because that allows you a lot more control, because remember, instruments are extensions of your hands and your fingers. So this allows you to kind of point and control things better. What you don't want to do is a lot of this, right? This gives you certainly a power, but it doesn't give you any finesse. And remember, when you're suturing, especially, when I do upper limb surgery, we're working around nerves, we're working around all these, fine vessels and whatnot. We need to have finesse. So practice that. Again, that's also one of those things that takes a little bit longer. Now, if you're a little more advanced and you feel more comfortable, what you can do that gives you a little more range of motion is actually you keep your ring finger in there, but you take your thumb out. So this is kind of a half palm, right? So you still keep your finger there, but what this allows you is actually a little more range of motion this way in terms of like prosupination, so that you can actually throw the sutures a little easier. And then once you've mastered that, then the real palming, if you really want to, is that the benefit here is the palming just means that you're holding the instrument in your palm and you're opening it, you can see like this, by just closing your palm. And the benefit is that, your full range of motion, you can grab whatever you want to, but again, you have a lot less control over that. So what I recommend if you're a beginner, fingers in, index finger on the neck. If you're intermediate or a little more advanced, you can take your thumb out. That gives you that little bit of motion. In terms of your forceps, what you want to do is use an underhand grip, because again, this is going to give you the most precision, right? You want to be able to point and grab things. What you don't want to do is, one of these things, because again, there's much less precision. So you don't want that overhand grip. So I'm just gonna fix my camera. It keeps drifting. Give me 2 seconds here, guys. Sorry about that. So now we're ready to kind of start suturing. The other thing is you have to give yourself a very good base to start with. So what I mean by that is, don't keep sit up straight, but don't keep your hands in the air wandering like this, because again, there's no finesse, there's no control. What you need to do is ground yourself. You can't see my elbows right now, but if you ground yourselves on the table with your elbows, and so all you're doing is moving your wrist and your hand, that's the easiest way to do it. And even better, if you're doing very finesse type suturing, what you can do is actually even put the ulnar border of your hand just along the patient or along the table, and all you're doing is moving your fingers here, and that gives you tons of finesse. The other thing you can do is, if you can't put your hand down, just use your pinky. And if you put your pinky just contacting something, whether it's the patient, then that's the easiest way to do it. So here we go. The way you load it up is, once you get going, is you want to load it about 2/3 of the way up, like so. And we're going to start with a simple interrupted suture. And the simple interrupted suture is probably the most common thing you're going to do. So what you can do is you grab the skin and you want to go in perpendicular to the skin this way, and about 5 millimeters from the skin edge, and then you do that throw, and you can see I'm supinating my wrist to get that throw. You want to pick it up, the sharp end, with your forceps, and then while you're down here, don't pull it all the way up. While you're down here, just reload it like that. Again, 2/3 of the way up. And then throw, and you're coming out equidistant, so another 5 millimeters from the side. So you can see that. So as you're pulling through, you can see the important part here is that this distance from skin edge is equal to that distance, and I am perfectly in line and perpendicular, and that's going to give me a perfect throw. And what I'm going to do now, as I throw it, you want to do your first 2 loops towards the incision. So this way, towards the incision, not away from the incision, because that will give you a nice, cleaner closure. So as you do this, you go 1 and 2 towards the incision, and you grab it, the other tail, with your forceps. And if you're closing the skin, you lay it down, and you see how that is a perfectly square knot right there, right? And so that's a nice square knot. And a square knot just means that it's laying flat on the skin surface. It's not, and if you pull the other way, you can see that one is not a square knot because it's kind of coming out a little bit. Sorry guys, here, let me get that closer for you. Yeah, that's better, sorry about that. So here, let's try that again. So once we've made that throws, you can see I've made my throws, so I'm equidistant from there to there, right? And so what you do is, again, you want to throw towards the incision. So my needle driver is at the incision, and you're just wrapping it twice around there. You're grabbing it, and again, pulling perpendicular, and you see how that is a nice square knot because it's laying perfectly flat on there. If it's not a square knot and you pull the wrong way, so you see how it's bunching up a little bit, right? And it's lifting off. So that is not a square knot. So you go like this, and then now, same thing. You keep your forceps in the middle, and you throw towards the middle of the incision. So again, now this way, now you do 1 throw, and then you pull your hand that way. And that is, you see it there, is going to be a perfectly square knot. And then if it's vicryl, or sorry, some kind of braided, you want to do a 3rd one, again, towards the incision, and then pulling the opposite direction. And that's going to be a perfect closure. And if you're doing, for braided, you want to do that 3 times at least. And if you're doing a monofilament, you want to do that at least 5 times because it's a little more slippery. So that's the basics of that one. I mean, does anybody have any questions about that? Throw them up in the chat, and Justin can help us out there. No, clear as mud, right? And so it's really important to get to this. Yes, we're gonna do running subcutaneous stitches 13 later on. So that's actually one of the ones I'll demonstrate to you. So just hang tight. And a great question in terms of keeping the tension, right? So one of the great tricks you can do. So I will show you that with our next knot, which is going to be an inverted one. So the beautiful thing about the simple interrupted is that if you can master that, that forms the basis of all the other knots, right? And so now what we can do is I'm going to show you exactly what the question in terms of keeping the tension. So now what we're going to do is we're going to actually do what's called an inverted simple. And so this is great for closing. This is actually what we normally use for closing subcutaneous tissue, so the layer right before the skin. So then it's exactly a simple interrupted, it's just upside down. So instead of starting on the far side on top of the skin, what you do is you start in the subcutaneous tissue, you again pick that up gently, and you actually start inside it. So we call that, so deep to superficial. You guys may have heard that before. So just for demonstration purposes, I'm going to come out through the skin just so I can show you. But normally what you would do, you go deep to superficial like this way, and you can actually see how I'm not quite pierced the skin yet. So I'm all in the subcutaneous layer. And actually this might actually work, so I'll just keep doing this. And so then you pick it up again, and then you go to the other side. And so you do what's called a superficial deep throw. So, but you want to keep the same depth. So again, you can see I'm going in perpendicular. I'm using my supination, and I'm just supinating through there. And I can just grab that coming out this way. And so you see how the benefit of this is that it's all buried now, right? So all the suture is going to be buried. And if you can see down here, the knot is deep because all your ends are coming out deep. The knot is going to be buried very deep into the subcutaneous layer, and it's not going to, cause any stitch abscesses or anything like that. So again, you have your two sides now, right? So this time what you do is this exactly the same steps. So you throw towards so here are your two sides, and you want to throw your loops towards the incision. So there's a 1 and 2 towards the incision, and you grab. But this time, instead of going perpendicular, because this is an inverted and deep in the subcutaneous layer, what you want to do is you want to pull this in line with the incision. And this is a very thick suture, that's why that's not coming together perfectly. But when you pull in line with the incision, that's what's going to have the incision come together nicely. And so unfortunately my suture pad here has failed me, so what I'm going to do is I'm going to try that again with a smaller suture. So I'm going to change to the Vicryl, so hopefully you guys can still see that one. Give me 2 seconds here. So here's a Vicryl number 1. This is actually what we normally use to close anyways, so it kind of works out. It's purple, but not as thick, so hopefully you guys can see the purple. And essentially, what you do here, I will use the bigger wound, this one. So again, so deep to superficial, again this way. And then you pull it through, and then superficial to deep, like so. So make sure you're not looped like that. And so you want your ends to be free, right? So now as you pull this through, I'm just going to show you so the ends are totally free, right? So you have your two ends again. And so again, you want to throw towards the wound. So this is the inside of the wound. So 2 throws, 1, 2, grab your tail, and again, pull lengthwise along the incision. You see how that brings it together really nicely on the end. Again, this is not the perfect suture for it, but the question about tension. So let's say that was a very tense wound and that didn't close very well. So here's a trick that you can use is you do the same thing, right? So you kind of go back towards the wound. So you're over here now, you go towards the wound, but this time before you grab it, you actually grab onto your loop. Can you guys see that? So I'll show you that again. So you go around this way and you grab the loop. So your needle driver is in there, but you grab the loop, and then you use while holding on to it, you grab the end. and keep holding on to the loop, and you're pulling as hard as you can, again, in line with the incision, and that will bring that tension nicely together. And as you do so, you keep that taut, and then you pull this side through. And again, in real skin, this is not going to cut out, and that will give you some nice tension. And that is how you achieve better tension when you're closing. So again, you can see that that is an inverted simple, and that's exactly the same, except it's just upside down, and that's just going to bury the knot. So do you guys have any questions regarding that one? That tension trick is really, really important. You know, we use that essentially all the time. And that is also helpful in terms of getting really good closure. The next one's, you know, throw your questions up in the chat if you guys have them, because otherwise I'll just kind of keep moving on and assume you guys know everything. And hopefully, I think people want to do a lot of hand tying, but we'll keep going on this one for now. So the next ones we can do are what are called the vertical and horizontal mattresses. So again, these are, are just all variations on. These are just all variations on the simple stitch. And now, so the vertical and the horizontal mattresses are just two simples placed together. And they're for different purposes, but I can show you that as well. So the vertical is a tension relieving stitch. So on the topic of tension relieving, it's really good when you're closing kind of the superficial and deeper layers and to create a tension-free repair. And so it's two simple stitches oriented vertically on top of each other. So what you do is you go, you can see here, you start, again, like a regular simple, you go what's called far, far, then near, near. So you start a little bit farther, maybe 8 millimeters from the skin edge, and you go through, right? And then you come out this way, come out the middle of the wound, like so. Pull that through. And then you reload your suture, your needle, and you do the same thing on the other side. So you're going deeper, and you're coming out a little bit further away. And so you pull that through. So that's your first throw, and that's your first simple that you've just done. And so now you just layer another simple on top of that. So, but this time, instead of going back across, you're starting on the side that you just exited and going back the other way. And so you switch, you got to go, now you have to backhand load your needle. So you got to backhand it like so. And then now you start closer to the skin. So now you're doing that about 3 to 5 millimeters, and you're doing a little bit more of a superficial throw. And you're doing the exact same thing on the other side like so. And what that does is that is beautifully tension relieving, and that brings together large wounds. And so you can see here, there are two separate strands there. So that's a superficial strand, and that's the deep strand. And as you pull that together, it's like so, you can see how that really nicely brings together those two layers. And you can see I'm just in a straight line like so, that's the vertical part. And you, again, this time though, you want to tie towards the other suture. So imagine your incisions in here, you want to tie towards the other suture. And again, this is when you want to lay flat like so, right? So there's a nice square. And again, if that's, losing a little bit of tension, I can do my trick. So I can grab it, hold it like that, and then pull this one through. And see, I'm just pulling that. You see how that's coming? I'm just pulling on this one by holding this steady, pulling on that one. And then once I've gained the tension that I want to, I can keep this just a little bit of tension and then pull this one through. And that, again, is my tension trick. So you can see that has brought that together very nicely. And again, I throw it towards the other one, switch my hands, go the other way, and just finish it off. And how many ever throws you think you need? Again, 3 or 4. Yes?
There's a question from the chat. The question is, are there any techniques to switch from forehand to backhand?
Yeah, definitely. I mean, the easiest one is just, and I'll show you that right now, is just, there's, everyone has kind of their own little trick to do it, but the easiest way really is if you kind of just, again, here you can load it up. You're loaded up like that. And what you do is instead of letting it go all the way and dropping it, you're just gently holding it. Instead of being clicked in, you unclicked it, but you're still holding it, and you literally just rotate and follow the curvature, and you just kind of bring your hands up and over, right? And as you bring your hands up and over, it goes right into your backhand, and that's out of frame. So here's your forehand, and you just bring your hands up and over like this. You're twisting it, and you're set to go for your backhand. So that's the easiest way, and that works every single time. A couple of my buddies have some cool tricks, like, they'll do, you can do things like, if you just touch the tip onto the patient's or the skin or something like, or a huck towel or something, so you can just kind of go like this, and you can do the same thing. You can go to the backhand like that too. So there's lots of tricks, but the easiest way, again, is just hold it with the forceps, keep holding it, although unclicked, with your needle driver, and kind of just go back and forth, like so. Good. So that was a vertical. So on the same lines of a vertical, then what you want to do, and the next one is what's called a horizontal mattress. So again, another variation on the simple interrupted. And so where the vertical was two simple interrupteds stacked on top of each other like this, the horizontals are two simple interrupteds stacked side by side. And instead of being a tension relieving stitch, this horizontal mattress is actually for everting the skin edge, and that brings the dermal layers together to help them heal. The danger here is you don't want to strangulate the tissue, because it's really easy to do that, but I'll show you that in a second here. So again, you load it forehand first, and this time you can start your regular about 5 millimeters out from the skin edge. And so you go this way, and you just throw it. So you come through. You can grab it here if you want to and bring it out and then throw it again. But to save a step, you can just go through both at the same time, and that comes with a little bit of experience. So you can see I'm 5 millimeters on both sides, right? So then I bring this through. And so now, again, using that backhand trick, I do need to go to the backhand now, right? So I'm unclicked, and what I just do is I just go this, I'm holding it, and I just go this way, bloop, and now I'm backhanded, and now I can click it once. And so here, what you want to do is locate your second stitch horizontal, or translate it either this way or this way, so down the skin somewhere. So instead of going deep or superficial, I'm just going to go right beside it. And so your goal is to make a box. So here, 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 and here. So everything should be equidistant. So 5 mils, 5 mils, 5 mils, 5 mils, 5 mils. So if I start here like so, I'm approximately, again, 5 millimeters away, doing the same depth of the throw, right? And see how I'm coming out through the skin edge, or sorry, through the incision. And again, I can grab this and pull it out if I want to, or I can just easily go through the other side. But the important part here, as you can see, is once you do that, you have a nice box. So from there to there is equidistance from there to there, and that's equidistance from here to here, and here to here, and here to here. And as you can see, when you pull that tight, you see how that is going to nicely evert the skin edge. And so again, now you just throw towards your other suture. So again, I'm going towards it this way, so not outside of it, so towards it. So 1, 2, and I'm grabbing the end there. And again, I'm just crossing my hands now, so lay that flat. But as you lay that flat, so I'm just trying to get the light better so you can see it. So as you lay that flat, you can see how that is bringing that and everting this skin edge right there, right? So same thing, once you've laid that flat and you're everting it, that's gonna bring the dermal layer together. You just finish it off, and you can use that tension trick if you require to, or you can just keep tying, again, 3 to 5, depending on if it's braided or a monofilament, and yeah. And so again, now you have two different strategies of putting these skin edges together by doing two simple. So again, everything is just a modification on the simple. So that's pretty much it in terms of that. And then so the last one I was going to demonstrate is in terms of suturing is the simple interrupted, or sorry, the running subcuticular. So apologies in advance, because I'm going to try to do this with a big fat suture. Normally be using like a 3.0, 4.0 monocryl for this, which is a very small monofilament. So what I'm going to do actually is, so for 13, how many knots for each stitch? So again, if you're using a braided stitch, 3 knots to 4 knots should be enough. If you're using a monofilament, then 5 at least is kind of, the classic, principles of surgery question answer. So that's what, if you need to do more, that's totally fine, right? So just the trade-off is that if you do more knots, you can definitely see where the more knots you do, your suture, your knot stack is going to get bigger, 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 right? So if you're doing that in a subcutaneous area, that can get bothersome for the patient and then cause stitch abscesses. So there's a bit of a give and take. But again, sorry, generally speaking, 3 to 4 for braided and 5 for a monofilament. So then in terms of your running subcuticular, there's the starting and the ending. That's kind of the times when you're going to find differences among your attendings. So just ask them what they want. Some attendings, so let's say I'm trying to close this incision, right? And everything's been closed. I'm just trying to close the superficial layer, right? So then some attendings like you to just leave the tails, leave the ends, and just literally start outside the incision completely and just make a throw, and then come into the incision, and that's your first one. Other attendings like you to do a inverted simple like we did previously and tie a knot in the beginning. I actually prefer tying knot at the beginning because I think that's a little more secure, but because of the silicone pad and because of everything else, I'm just going to do this by not throwing a knot. So that's just the easiest way to do it. So you come in through here, and then there's a couple of tricks. So what I'm going to do is I'm actually going to, so normally you would obviously throw this in the subcuticular layer on either side, but just so you guys can see it better, I'm actually going to do it outside on the skin surface. So what you do, so if you're watching the replay, that's why I'm tying it outside. So what you do, you start at the end, and you, normally you'd be kind of in this vector, throwing it in here. And the idea is that you're throwing it like so, and you're kind of coming this way. And these are just continuous simple throws. So you bring it out like this. And again, this is all normally in the subcuticular layer. Sorry, I just said don't you touch it with your fingers, right? So you pull it through and you leave a tail out or you tie it. And so then your next throw is just simply going to go to the other side, right? So the other side of the subcuticular area. So this side you may be able to see better. So normally what you would do is you would throw it in the subcuticular layer so that the needles, instead of going deep, is kind of more on this vector, and you're kind of going more this way, if you guys can see that, right? Can you guys see that better? There. So that's where you want to throw it. Again, that's hard to see, so I'm just going to bring that back out and throw it on the skin surface. And the trick here, again, talk to your attendings, but the way I prefer to do it is if you've come out at this level, instead of going directly across it, you actually just go a little bit behind it and throw another subcuticular stitch like so. Oops. And you can reload it like that. And so same thing, then you reload it, then you come back to this side. Instead of going right across, you actually go back a little bit and throw it like this. Again, this would normally be in the subcuticular layer. And so on and so forth, right? And what happens is as you pull that, what you can see here is happening is as you pull that, you can see everything's coming together really nicely. And normally this would be closer together because again, you'd be in the subcuticular layer. So that's how you continue on. So the fun part about this is actually the closure on the other side. And so oftentimes people will do what's called a fisherman's knot. So let's say you have one more over here and you're just gonna bring it like this way. And so, and let's say you're at the end of it. So what people do is, this is called a fisherman's knot. And I don't know if actually fishermen use it. I mean, I fish, but I don't use it, but I'm also not a very good fisherman. So sorry, that one pulled through there on my silicone pad. So I'm just gonna do this maybe one more time like so. And so the fisherman's knot is that you maintain the loop. You maintain the loop like that. And what you're doing is, this one, unfortunately, you can cut the needle off to be safe, but you do have to manage the needle a little bit. Or you can actually, what some people do is they'll actually just protect the needle and then tie. And so you have the loop and you reach through the loop, you keep the loop open, reach through the loop, and then you actually pull this through, pull the knot through, and you can see, and then you're just pulling your free suture through. So that's one throw, and you do it another time like so, and do a third time through the loop. This is very loose, I apologize. And then you pull the final, instead of just pulling half the loop through, you pull the whole needle through, and that's locking it. And then you grab it. And again, this would normally be at the end of your incision, so you kind of just go through the end like this, and you bury it, like so. And so that's how people normally close it. I mean, it's a nice little way to it. The knot stack is a little bit, it's there, but you can bury it other way. I actually don't know if it's the same as an Aberdeen knot or not. I have to look up what an Aberdeen knot is, but we call that a fisherman's knot here in Canada. So yeah, and that's kind of a nice way to close it. And then, normally what I would do is put just a big line of stereo strips, again, longitudinally, not transverse. Transverse people I've seen actually get a lot of kind of burns and superficial abrasions from that. So longitudinally, and yeah, and that's pretty much it. And so do you guys have any questions regarding the actual suturing aspect of everything before we go on to hand tying? And just throw them up in the chat, but if not, I'm currently going to get ready for just the hand tying. But Justin is monitoring that chat, so just keep it, keep asking those questions.
Dr. Long, do you have any other comments on the spacing of each throw for the running subcutaneous stick?
Yeah, so that's a great question. So it actually depends on the needle size you have. So I'll get you another needle and I'll show you.
And one more, can you show the first knot that you did again, please?
Yeah, you mean just like the simple interrupted?
Yeah.
Yeah, no problem. So let's ask it. So again, that is a number 1 that we were using, right? So that's a big fat suture that we use to close the kind of deep layers normally. So what you really be using is something more like this. This is the size-wise, this is a 3/0. This is obviously braided, so you'd probably use a monofilament, but this is something size-wise you would use. So you can see the needles are going to be very different in size, right? So the needle here, I'll just lay that on there, compared to like a needle of a number 1, which you can see here. And, So what we always kind of say in terms of how long your throws should be or how the spacing is that you want to just go one length of the needle. And so if you're always starting and grabbing the needle 2/3 of the way up, so you'll probably be going 2/3 of the length of the needle. So what I mean by that is, as you throw it here, so you see how I'm loading it about 2/3 of the way up. And if I go like this and I throw it in here, as I supinate my wrist, it comes out just as I'm touching, the needle driver is touching the skin, right? And so that gives you about 2/3 of the way out. And you can, increase or decrease this distance based on your preference. But then as you reload it, you're still going to reload it about 2/3 of the way up. And so the same thing. So as you go through here, your next throw will just be exactly the same. So I'm going to load that up here. And so your next throw, let's say the incision's right in the middle, you're going to go a little bit behind it. And drifting a little bit there, sorry guys. And so again, throw it and supinate the wrist until, again, you see how this is hitting it. And so that's, again, going to be the same distance. It's not so much how far apart you want them spaced. It's actually that you want to maintain consistent spacing between everything. That's the important part. And that's what makes the wound close nicely, right? So you can see here my 2 throws, right? So that distance from there to there is the same as that distance from here to here. And so again, that's the really, really important part of suturing, is maintain that consistency. So again, just to demonstrate again, I'm going to go back to the big fat suture so that people can see it. I'm going to grab a new number 1 here. And sorry, give me 2 seconds. I'm just going to just readjust this camera thing again. Give me 2 seconds here. Good. And so a simple interrupted is, as you can see here, I'll show you on here, and let's just choose this one for ease. So what you want to do is you want to, again, load your needle about 2/3 of the way up, and you start you start about 5 millimeters away from the skin edge. So about that distance away from the skin edge, right? And again, you're perpendicular, and you're just, all you do is once you pierce the skin, you can see my supinating the forearm to bring that through, right? And that allows you hear that saying, let the needle do the work. What you don't want to do is, if you've ever been sewing and, you come out and instead of having a nice curved needle, the end is bent straight, you know that you're not letting the needle do the work. That is you forcing it through, and that is not the correct way to do it. So what you need is just a little more supination in your wrist. And so same thing, so you bring that out, you load your needle back up, and again, you go same depth, and you put it through like so, and same distance away. Again, you see all I did was I just pierced the skin perpendicular to it, and just by supinating, it comes out the exact correct distance every single time, right? So really that supination is what really is gonna bring me there, and that's the important bit. So as you bring this out like so, now you're tying. So here's the incision. You always want to tie towards, or throw your knots towards the incision, not away from it, right? So 1, 2, and you're grabbing the edge right there. And in this case, you're just throwing it, laying that knot perpendicular. And you can see how that one is nicely, the knot is nice and flat, right? And so again, now your next knot is going to be like this. So you throw again towards the incision like this. And if you need to, just grab it. Remember we talked about that trick about grabbing the end there? And that's your tension trick. So you pull it again this way. You pull the loose, your free end until it's taut, hold it there, and then hold the tension and then throw it this way. And then pull the rest. And same thing for the last one. Just switch your hands every time. And because it's braided, you get 3. So yeah, so there it is. That is the repeat of the simple interrupted. I'm going to now, so again, I work in an urban center here in Vancouver. So I always tell, the question was thoughts on using your hands versus your instruments to reload the driver. If you get used to always using instruments to reload, you're never going to run into any problems. If you ask your attending, you ask themselves, when do you get poked? It's late at night, or you're not concentrating, or you think you're kind of you're almost home and you're finishing up, and then you just get careless, and that's when you poke yourself. So always, as much as possible, and I would just argue all the time, just use your instruments to reload everything. All right, so now what I'm gonna do is move on to hand tying. Yeah, absolutely avoid unnecessary needle sticks. Nobody wants a needle stick. That is the, it's one of the it's the worst thing. So you just want to stay safe. So here we go. Let's do some hand tying now. So what I'm gonna do is I have made this string. Hopefully it's gonna it'll work reasonably well. So one end is the orange side, obviously one end is the black side, and it's nice because not only will you see 2 ends of the string, like so, you're actually gonna see 2 different colored hands. So I'm gonna zoom out just a touch here. And give me 2 seconds here to set this up because I need to sew this down to make this work a little bit better. And as I'm doing that, does anyone have any questions that I can answer about those sutures? If you can master those, 5 stitches, you can close a wound. That's kind of the way you want to do it, right? So. Justin, I'm just suturing. Can you just monitor the chat to make sure there's no further questions on stuff like that?
For sure.
Thank you.
Actually, I had a question.
Yeah, no, of course.
Where can you buy all of these equipment to practice at home?
Yeah, so hopefully people got my email, and I try to keep this as low cost as possible. So I always say, in terms of getting suturing stuff, just ask your hospital. Everyone always has expired sutures that they can that the hospital needs to give, I mean, basically just at our hospital, there's just a bucket of expired sutures, and you just you just go ask for it, and that's the easiest way to do that, and it's also the most cost-effective way to do it. In terms of all the other gear, just see if your program has some. For example, everyone has an anatomy lab, right? Just go to your anatomy lab and just see if they have anything you can borrow. In terms of pickups and pickups, forceps, what you call pickups, and the needle drivers and things like that. So in the absence of that, if you really want like a suture, and instead of a suture pad, you can see they're not perfect. Just use get a piece of meat. We used to practice on chickens and chicken thighs and lemons and oranges. So those are all easy ways. So, but if you really want to buy stuff, you can just go online and just buy things. And I do have a lot of affiliate links, like I said in my email I sent out. I get as you guys know, Amazon, so you get a commission from that if you guys do buy, but you don't have to. But if you want to, that's how you do it. So here we go in terms of hand tying. So again, I'm just you might have seen my videos on it, but essentially there's two ties, and again, everything's based on this. There's an underhand tie and an overhand tie, so I'm gonna move these guys out of the way. And so essentially what you're trying to do is trying to slide your knots down, right? So I learned this all from a vascular surgeon, so I feel like it was pretty good. It was a very good teacher. And so what you do is one side is always your post and one side is your tying, right? So in terms of your post, what you do is that this is always taught. So my post is going to be the orange on my right hand. I'm going to tie with my left hand, right? And so you can do the opposite. So as you hold the post down, there's two different times. There's this one, which is called the underhand tie, because you can see on the black, I'm going under the post this way, and there's an overhand tie, which you're going over the post that way. So if we start with the underhand tie, that's probably the easiest one. So what you do is on the hand you're tying with, you pinch your suture. So you just pinch it regularly, not at the tips, but maybe at your DIP joint of your index finger, and then with your tip of your thumb. And so what you do is you take the rest of once you've pinched, you take 3 fingers, you lay it over the rest of the suture, and you just turn around this way, and so that it's wrapping around your fingers. And so then what you do, you go, again, it's an underhand, so you go under. This is the, sorry, yes, 13, this is the one-handed technique. Sorry, yes, great question. So this is the one-handed technique. So you wrap it and you go under, and then you go under your post, which is the orange one, right? And every time you do this, you want to make this X. You can see the X right there. And so once you make the X here, with your left hand, the one you're tying with, you flex your fingers over the orange, flex them, and you just basically grab the black suture between your your long and your ring fingers, and you're just bringing it through the loop. So all you're doing is just tying a knot. It's like a regular knot. It's just like a fancy way of tying a knot. And so then you can see it's tied. So you keep this post taut, and you're just slide that down, slide. So I've tied this so it's not going to slide perfectly for me. I just can't find a lamppost, unfortunately. But you see how that's kind of tied down there, right? And you can slide that and pass point all the way you want, right? So that is how you do it. But if you kind of just slow down and see what you're trying to do, all you're literally trying to do is this. Imagine it's like tying a shoelace. All you're trying to do is essentially this, but you're just doing it with a hand. So this, I mean, that's a full hitch, but I mean, you're doing all you're doing is essentially half hitches, right? So all you're doing is this. There. So yeah, so basically, again, it depends. If you want your first one to be a slip knot versus square, depends on what you're doing. So my argument is, if you're tying something, you probably want it tight. Nobody throws air knots. So it's always good to have a slip knot for the first one. I'll show you that right now. So what happens is that, again, let's just do that one again. So the underhand throw, so that, again, the orange is my post. I'm pinching the black. Hands go on top of, fingers go on top of it. I flip it around this way. I make the X, and I go around the orange, and I'm grabbing it with my fingers and just bringing it through the loop. And as you do that, you slide that down, you keep your post taut. So this is a slip knot, right? You can see that. It's not square, but this is what's going to be able to, you're going to be able to kind of tie things down really tightly. So what I do is I always back that up with a second one, and I do the exact same throw again. So again, you can see pinch, over top, flip, and then grab like so. And if you do the same thing and you past point on this one, and you, again, the post is always straight, never to the side, always straight. That allows you to create a slip knot down here, and that will be extremely tight. It'll be tight, but it's not gonna be secure. So then to secure it, you have to throw the other one, an overhand tie, and basically create like, create the, and lock it in. And so the way you throw an overhand is, again, keeping the orange or your post taut. Instead of pinching with your index and thumb, you're gonna pinch with your long or middle finger and your thumb. And your index finger is gonna slide up the suture this way. So you have a little, like a little band of suture. And what you do now is that you keep it taut and you go over the suture instead of under suture, and you go over the suture and you make the X, the cross, with that little band of suture. And so same thing here. And so you just let go of the black suture with your index finger, go underneath and around the orange, and then grab it, the black, and pull it through the hole, pull it through your loop like that. So your finger's just basically pulling things through loops. And so as you slide that down, you now, instead of having a taut post, you can then square it up like this. And so what you have now is, you can see a slip knot, one knot, two knots, and there's slip knot, and that's gonna be tight, and you've locked it in with another one. And what you'll do is you can switch hands, you can do anything like that. You can back it up with your final one, so you do 4. And that's how I learned it from the vascular surgeons, and they did this with, small arteries, big arteries. So I feel like that's very, very secure. That's how I've been doing it. So you can see that it's a slip knot, then backed up with a, essentially a square knot or a locked knot, right? And so that's the easiest way, I think, to do one-hand tying. So I'm gonna show you both those overhand and underhand one more time, really quickly here. Do you guys have any questions about that? I'm hoping the colors, the black and the orange, as well as the two-handed, two colors of my gloves, is a little bit helpful. Remember, I have videos for these that are all kind of like, suture in 60-second videos on my channel. So you can always look at those too. And the purpose of those kind of suture in 60 seconds is so that you can look it up right before you go into the OR, because that's the way I used to do it. And just kind of look at it. So yes, you're securing knots. Yeah, so not pushing. You can do index finger. Index finger you have a lot of precision with. You can push really hard if you need to, but also just lay things down. So that's the best way to do it. Actually, somebody made fun of me because they said you must be an orthopedic surgeon because I'm pushing knots with my thumb. So, but yes, generally speaking, index finger. So again, really quickly, I can, would it help? I'll just do it with my left hand this time. So black is the post this time, right? So black is the post. So again, I'm pinching at my DIP of my index and my thumb. This is the underhand one. My fingers go over the orange and I flip it this way, and they go underneath the post, and I make that X. And as I make that X, I flick my fingers around this way and I grab it and just pull the orange through the loop. And again, tying down and securing that, again, pointing with your index finger like so. And again, I would do the same thing again, but I'll just show you the overhand one. So the overhand now with the left, my black is still the post. The orange is now my tying side. Instead of pinching with my index, I do thumb to middle finger, long finger. My index finger slides up, and this time I go over the post, and you can see I'm making that X there, that cross, and I drop the, keep tension, I drop it, and then and then I go around and grab it around the black, grab it and pull it through. And then kind of just slide that down. And again, you can just do like this. So those are basically how you do the one-handed ties. Definitely get good with one hand before you try both hands, but certainly it is beneficial for many reasons in clinical practice to tie with two hands, or being able to tie with both hands. And then finally, just the double-handed surgeon's knot, right? So this is one where you're trying to lay a square knot. So again, all you're really trying to do is literally this, right? 1, 2. You're just trying to make you're just trying to make a double knot, just like we did with the instruments, right? That's all you're trying to do, right? And you can bring that down. See, all you're trying to do is lay it square. So if you guys have seen my video, the slickest way to do a surgeon's knot, like a two-handed throw, is don't even worry about you know, the other ways, because all you do is take these skills that you've learned right now, the single-handed throw, and you just put them together, right? So this is the one. If you can master this, this would be great. So again, on your black or my left hand, what I'm going to do is I'm going to do an underhand throw. So again, I'm pinching it, index to thumb, and my fingers go up and I'm flipping it around. On my other hand, I'm preparing to do a overhand throw. And so again, pinching thumb to middle finger and then index slides up. And what I'm doing, I'm bringing my right hand over. I'm making that cross, you can see. So they're posts for each other. And so now what I do is for the orange side, I'm doing an overhand throw. So I reach under the black and bringing it through the hole like that. But before I pull it tight, my left hand does its bit and reaches over the orange, grabs the black and pulls that through. And you can see that is a perfectly square knot. And you can just lay it down like that. And there you have a surgeon's knot. So again, that in full speed is just like this. So underhand on the orange side this time because I switched hands. Overhand on the black. You just kind of do both at the same time. Pull it through. And that is your square knot. And so this one, I mean, to be honest, theoretically, you can still slide this one if you want to by keeping one side as opposed. You can always just cinch it down, and then pull it tight. But that, for me, is the easiest way to do a two-handed tie. And you can see it works very, very well. It's a very secure knot. It's really easy, and it requires no further kind of thinking. Yes, I can definitely repeat that. So let me just undo all this stuff first. So what I'm doing now is, so again, you choose. One side's going to be an underhand, one side's an overhand. So my left hand is going to be the underhand, my right hand is the overhand, and they're just both at the same time. So pinch, thumb index, go over top, and then flip it around. This is the underhand portion, right? And then thumb to long finger, and then slide your index over, and then you bring it over top. So you bring your right hand over top, if this is how you're doing it, and you see the X. So the X is there, right? And so what you do is you do your regular overhand tie with your right hand, and then your regular underhand tie with your left hand, again through the loop. And you can do them one after another like this if you want to. And then what you do is you just make sure it's square, and you're just laying it down perfectly square like that. Ooh, it's really drifting. And so once you get really good, instead of doing one at a time, you just kind of do both at the same time, and you kind of just like so, right? And you just lay it down like that. So that's just a bundle of knots there. So that is like the slickest way, I think, to do a two-hand tie. So yeah, I mean, definitely keep practicing, keep checking out my videos. I think that's the best way. And you know, I remember when I was on call, we would literally just sit in the call room or, you know, sit wherever and just have a suture with us, you know, and just keep running knots up and down like like the lamppost or, you know, an electrical cord or something, right? Until you got really, really fast at them. So, you know, take whatever chance you can to practice. Again, the best way to get the sutures is go to your hospital to see if they have any leftover or expired sutures for you guys to use. We have a whole bucket full of them that, you know, again, we would just let us grab. So yeah, I mean, so remember, you know, these rounds are gonna be happening. I'm just gonna bring it back to myself here. So these rounds are gonna be happening every Monday at 5 p.m. It's gonna be a different topic. You know, check that link in terms to check out what the topics really are. There's gonna be a lot of good ones, especially since the CARM's different processes are coming up. And remember, if you need a little more help, you know, there's a couple of options. Reach out to me on Instagram, and I do have a subscription for group coaching now, so definitely check that out, and there's a discount for the first for the first 5 people that sign up, and that's going to be a weekly coaching session that's going to start in a couple of weeks once we kind of get the membership going a little bit, and I think this will be really beneficial as well. And always remember to reach out to us if you have any questions at consults@scrubbedout.com, consults@scrubbedout.com, and we can always, I always try to check my DMs on Instagram, TikTok, and on YouTube, the comments as well. So hopefully that was helpful. I'm going to email out to everybody a feedback form just to kind of make it official, and hopefully continue to improve on these lectures. And as you see, we're going to have a lot of guest lecturers and guest talkers, speakers throughout the course of the sessions of the season. So yeah, thanks again for joining us. I really appreciate you guys. I know there's a lot of content, a lot of people you can learn from. So again, really appreciate you coming to spend some time with me to doing this. So see you hopefully next Monday. Talk to you soon. Bye.